It is a privilege to grace your screen with another episode of Ladyz Digest, where issues in the world of women are discussed. And Ladyz Digest is brought to you by AAU TV, the voice of higher education in Africa. The majority of women have uncomplicated pregnancies and birth. However, gestational diabetes is a complication of pregnancy that is becoming more common in women of all ethnicities. When we return, we'll discuss more on it. Remember, you can join the conversation, drop your comments and questions on our social media handles on Facebook and YouTube at the Association of African Universities and on Instagram at Ladyz Digest. I'll be right back. Welcome back, and this is still Ladyz Digest, and I'm your host, Joan Iyoha. And our first question will be, what is gestational diabetes? Gestational diabetes is diabetes diagnosed for the first time during pregnancy, that is gestation. And like other types of diabetes, this gestational diabetes affects how your cells use sugar. So let's talk about the causes of this condition. Researchers don't yet know why some women get gestational diabetes and others don't. Excess weight before pregnancy often plays a role. Normally, various hormones work to keep your blood sugar levels in check. But during pregnancy, hormone levels change, making it harder for your body to process blood sugar efficiently, and this makes your sugar rise. So let's get to know some of the conditions or factors that place pregnant women at risk. Some women have a greater risk of gestational diabetes. Risk factors for gestational diabetes include the following: overweight and obesity, a lack of physical activity, previous gestational diabetes or prediabetes, polycystic ovarian syndrome, diabetes in an immediate family member, previously delivering a baby weighing more than 9 pounds, that is 4.1 kilograms, race, as women who are Black, Hispanic, American Indian, and Asian American have a higher risk of developing gestational diabetes. So let's get to know some of the symptoms that a woman would have when she's having this gestational diabetes. For most women, gestational diabetes doesn't cause noticeable signs or symptoms. Increased thirst and more frequent urination are possible symptoms. So with regards to seeing a doctor, if possible, seek health care early when you think about trying to get pregnant, so your doctor can check your risk of gestational diabetes along with your overall wellness. Once you're pregnant, your doctor will check you for gestational diabetes as part of your prenatal care. If you develop gestational diabetes, you may need checkups more often. And these are most likely to occur during the last 3 months of pregnancy, when your doctor will monitor your sugar level and your baby's health. Gestational diabetes that's not carefully managed can lead to high blood sugar levels, and high blood sugar level can cause problems for you and your baby, including an increased likelihood of needing a cesarean section. If you have gestational diabetes, your baby may be at increased risk of the following: 1. Excessive birth weight, that is higher than normal blood sugar in mothers, can cause their babies to grow too large. Early or preterm birth. High blood sugar may increase a woman's risk of early labor and delivery before the due date. low blood sugar, which is also known as the hypoglycemia. Sometimes babies of mothers with gestational diabetes have low blood sugar shortly after birth, and severe episodes of hypoglycemia may cause seizures in the baby. Also, the baby can be at risk of obesity and type 2 diabetes later in life, as babies of mothers who have gestational diabetes may have a higher risk of developing obesity and type 2 diabetes. And worst of all is stillbirth. Untreated gestational diabetes can result in a baby's death either before or shortly after birth. And the following are some complications that may affect you, the mother: high blood pressure and preeclampsia. Gestational diabetes raises your risk of high blood pressure as well as preeclampsia. Having a surgical delivery, also known as the C-section, you are more likely to have a C-section if you have a gestational diabetes. And also future diabetes. If you have gestational diabetes, you are more likely to get it again during a future pregnancy. You also have a higher risk of type 2 diabetes as you get older. So let's conclude with some preventive measures. There are no guarantees when it comes to preventing gestational diabetes, but the healthier habits you can adopt before pregnancy, the better. If you have had gestational diabetes, these healthy choices may also reduce your risk of having it again in future pregnancies or developing type 2 diabetes in the future. Eat healthy foods. Choose foods higher in fiber and low in fat and calories. Keep active. Exercising before and during pregnancy can help protect you from developing gestational diabetes. Aim for 30 minutes of moderate activity in most days of the week. Start pregnancy at a healthy weight. If you're planning to get pregnant, losing extra weight beforehand may help you have a healthier pregnancy. And don't gain more weight than recommended, because gaining some more weight during pregnancy is normal and healthy. However, gaining too much weight too quickly can up your risk of gestational diabetes. So in conclusion, while any pregnancy complication is concerning, there is good news. Expectant mothers can help control gestational diabetes by eating healthy foods and, if necessary, taking medications. Controlling blood sugar can keep you and your baby healthy and prevent difficult delivery. This has been Ladyz Digest, and I've been your host, Joan Ioha. Many thanks to my production team for making this shoot a possibility. Till I come your way next time. Bye.